Welcome to the committee, Representative Cagle, and I will move House File 3339, the first engrossment, be laid over for possible inclusion in an omnibus bill. There is an author's amendment, so the chair will move the A3 to put the bill in the form the author intends for discussion. All in favor of adoption of the A3?
Aye.
All opposed? Motion prevails, and the amendment is adopted. So the bill is amended as you would like. Rep. Cagle, please proceed.
Thank you, Mr. Chair and members. So this bill is obviously somewhat personal to me. Being somebody who has suffered limb loss, it's often a surprise and a little bit traumatic. And so, you know, I was lucky that this happened to me late in life, and so I had, 40 years with all 10 fingers. But some people, don't have that and lose a limb at an early age. And I think back to my days in elementary school, middle school, even high school, how many sports I played, and how if I didn't have my fingers on my left hand, how I could control a baseball glove, or if I had lost a leg, and how would I run to the bases, And so some of these things are lifelong activities that we want people to do, and when you don't have the proper equipment, it's really limiting. And so this is just making sure that folks who have suffered limb loss get the proper equipment to live active lives that they want to live. And with that, I will turn it over to one other thing. These things are super expensive. Each one of these fingers runs between $5,000 and $20,000. And because it took so long for them to even get it was a year and a half that it took to get this thing approved. By the time I had gotten it approved and started working with getting this prosthetic, I had already gotten used to not using not having fingers on my left hand. And so now you think about any time I grab a grocery bag, it's putting all that pressure down there. And, people get bunions. I'm probably going to have a hand bunion someday, and bad arthritis. And so just thinking about how if I was able to use this and was more used to it, how it would really support my hand and my fingers. And now I just feel like it's kind of just in the way. And so I'm really getting it early, and making sure that we are able to use them properly is a really big deal. So with that, I will hand it over to my testifier.
Thank you. And the testifier would introduce yourself to the committee, please, and proceed.
Thank you, Chair Bierman and members of the committee, for the opportunity to speak today in support of House File 3339. My name is Elsa Keeler. I live with limb loss. In January of 2019, I was diagnosed with a rare, aggressive metastatic bone cancer. My right leg was amputated above the knee, and I underwent treatment for 2.5 years. I am so grateful to be alive and healthy today. From the very beginning of this journey, I worked with a prosthetic professional and my doctor to access a prosthetic limb that would suit my medical needs as an active adult. The process was lengthy, with many pages of documentation, prior authorization, and utilization review required. My employer-based health plan approved a microprocessor knee, and when my health returned, I embraced the outdoor activities that I loved: hiking, kayaking, cross-country skiing, and paddling and portaging on canoe trips with my family. In 2023, my prosthetic limb stopped functioning and was beyond repair. By this time, I had retired and was under my husband's health plan. I was prescribed a much-needed waterproof prosthetic that would allow me to safely shower and bathe on 2 limbs instead of hopping on 1, walk into the water to swim, actually run across the yard with my grandson Theo, and continue my active life. The claim was denied. It did not meet the health plan's definition of, quote, a standard model that met minimum specifications, end quote, for my needs. I found myself wondering if I'm worthy. I should also mention that I'm a retired pediatric physician. I have spent my career advocating for children's health issues. I am keenly aware of the complicated nature of healthcare coverage and how hard it is to accomplish needed change. However, the time for this change is now. This bill would assure that people with limb loss have access through their health insurance to the appropriate medically necessary prosthetics needed to run, walk, bike, swim, play sports, and improve their health. Active movement for people with limb loss is not a privilege, it is a necessity. We have overwhelming medical data on the benefits of physical activity in the prevention and management of so many diseases and ultimately life expectancy. This is very much an equity issue. Everyday elective knee repairs and joint replacements occur for the purpose of returning someone to active life. The orthopedic surgeon decides on the most effective internal prosthesis for this procedure. This is standard of care, routinely covered by health plans. But when a child or active adult with limb loss needs an external prosthesis for the same activity, they are denied coverage. This bill assures that health plans will cover prosthetic care for disabled and non-disabled people equally and no longer discriminate against those who need external prostheses in order to have active movement. The fiscal impact of this bill supports overall savings through improved patient health and lower healthcare costs. Safeguards are in place to assure proper utilization review and prevention of fraud. Medicare sets the standard for coverage of prosthetic devices, known as K levels, to determine which device would be most medically appropriate. An individual, like myself, is assessed an activity level from K0 to K4. Activity-specific blades and devices are prescribed only for those who meet the higher activity levels, including children, active adults, or athletes who have potential for running, climbing steep hills, or high-impact movement. As a pediatrician, I used to tell my young patients that their job is to run, jump, and play every day. Physical activity is one of the most powerful behaviors to assure a healthy body and a healthy mind. Children move spontaneously. They accelerate from 0 to 90 in seconds. For a healthy child with limb loss, their ability to run is not limited by the lack of a limb. They are limited only by the lack of access to the prosthetic device designed for running. Having a running blade to move should no longer be a privilege that is cost prohibitive for most families in Minnesota. Medically appropriate prosthetics for active mobility, safe showering, and bathing are necessary, safe, effective, and it's time for them to be covered by our health plans. I appreciate the opportunity to speak, and I'm happy to answer any questions.
Thank you, Dr. Keeler. And there is another testifier, Mr. Ellis. Please pull that microphone down and introduce yourself with your name, please, for the committee.
Hi everyone, my name is Walker Ellis. I am 9 years old and I live in Woodbury, Minnesota. I am in 3rd grade at Red Rock Elementary School. 1 year ago, I received my running blade from a non-profit organization called Wiggly Your Toes. Before, I only had a regular running blade, everyday blade that didn't offer much feedback. Since receiving the running blade, I have so much more confidence to be able to play sports that I love. Now I can keep up with my friends when we play soccer, flat football, ride my bike, jump on the trampoline, or even just playing tag. With my running blade, there are no limits for me. However, I still need an everyday blade to get around the house when I am at the beach and when I am in snow. But still, I use my running blade leg every day too. Both are necessary for me to be the kid that I want to be. So please support this bill so I can continue gaining confidence with 2 legs that are needed to accomplish my goals. Thank you for your time.
Mr. Walker Ellis, thank you for being here today. Really appreciate your testimony, very valuable for the committee. Thank you so much, and good luck with everything.
Thank you.
All right, I have, those are the only 2 testifiers I have on my list. Is there anyone from the public that would like to testify on this bill? Seeing none, we will move to member questions and discussion. Representative New Brindley.
Thank you, Mr. Chair. I'm wondering, line 6.1, I believe, applies this to our public programs. And so I'm wondering, I think we have heard that it already applies to CGIP. Does it already apply to public programs, or will this be a new benefit under our public programs?
Representative Cagle.
I thought it was, but I would like to actually defer to staff just to check.
Okay. Mr. Chun?
Mr. Chair and members, there is a current benefit for prosthetics and orthotics that's on Section 3 of the bill. And what the bill does is it kind of strikes the coverage language there, and it adds Sections 4 and 5, which provides more detailed language of the coverage that would apply.
Thank you, Mr. Chun. Follow-up?
Thank you, Mr. Chair. And perhaps, Mr. Chung, can you help us understand what the changes will be to the current coverage versus new coverage under this language?
Mr. Chair, Representative Brindley, I talked briefly with DHS about this, and they said that most of the new requirements are already something that MA does. For example, they pretty much follows, for example, the Medicare coverage guidelines. They did mention that lines 6.17 to 6.20, this would be sort of a new provision for medical assistance. And I think maybe if you have more detailed questions, perhaps they could speak, further to this.
Thank you, Mr. Chun. And the bill will be laid over if we want to dig into it deeper. Another question, follow-up?
Thank you, Mr. Chair. Does this have a fiscal note yet?
Yes.
Mr. Harney, could comment?
Mr. Chair, Representative New Brindley, the fiscal note request is currently active. DHS has not completed the fiscal note yet.
Thank you, Mr. Harney. Representative Brindley.
Thank you, Mr. Chair. Again, it seems that this will then expand the scope of what's currently done in the programs, in our public programs. So this will be an increased benefit that'll have a cost to the state. So it's important for us to understand what that is before moving forward. And again, I would just say again, in fact, Walker, it was so fun to listen to you testify. My brother was a triple amputee, and he didn't have either of his legs, and so we grew up with lots of legs. And let me tell you, you're going to have a lot of fun with old legs that you've outgrown, and the fun tricks you can play on people with those. So, thank you, Mr. Chair.
Thank you, Representative New Brindley. Representative Nadeau.
Thank you, Mr. Chair. Thank you, Representative Cagle. Can you explain to me on 5.25 to 5.27, we pulled out the definition in 256B of what a licensed practitioner is. Can you tell me why we did that, and under your bill, under 5.24, what a licensed practitioner is? Could it be a behavioral analyst? Who can prescribe now?
What line?
Representative Cagle.
Sorry. What line again? I'm sorry.
5.25
5.25.
to 5.27.
I'm not, I'm not sure on that one, actually. Maybe I would defer to my testifier.
Dr. Keeler.
Chair Bierman, I can't comment on the bill, but I can comment on the utilization review that all health plans have in place, and that is criteria for fitting, for prescribing of these prosthetics. They have to be, and I have that, fitted by a prosthetist experienced in fitting the specific prosthetic devices.
Thank you. And thank you, Mr. Chair. I'm not interested in fitting the prosthetic. I'm interested in prescribing. So maybe, does anybody know?
Dr. Keeler? And we have some help coming forward.
Actually.
Please introduce yourself for the committee.
Hi, my name is Terry Cuffle. I am from Spring Lake Park, Minnesota, and I work in the orthotic and prosthetic field. Representative Nadeau, the prescribers for orthotic and prosthetic care really are regulated by Medicare guidelines. We have O&P licensure in the state of Minnesota, so the professionals who are fitting the devices are licensed here. Those who prescribe the devices are on par with those that are dictated by Medicare. That would be physicians, physician assistants, specifically Giogo is here as well. We've had an amendment a few years ago with regard to the state plans and the prescribers who could prescribe for orthotic and prosthetic care. And those prescribers follow Medicare guidelines.
Thank you, Ms. Koppel. Representative Nadeau.
And thank you for that, and I trust that. But I'm just wondering if we're expanding, if this language expands it so that a pharmacist could prescribe a limb, for example.
That is not the way it works in Minnesota. So we do follow, again, Medicare guidelines. That's the way the system is set up. Also with the medical criteria and the documentation required of the orthotic and prosthetic facilities to bill for claims, we're required to work off an order. We liken ourselves to a custom goods pharmacy. So we have to have a prescription from a physician come through our door in order for us to deliver the prosthetic device or orthotic device.
Thank you, Ms. Koppel.
And thank you, Mr. Chair. And
Nadeau.
that's exactly my question. You're going to get that prescription from a licensed practitioner, and what we're doing what this language is being stricken. So it's basically saying that it used to be that a physician, an advanced practicing registered nurse, the physician assistant, or a podiatrist could prescribe that, and we're getting rid of that, and it's now just a licensed practitioner. So can a psychologist, can a behavioral analyst? I mean, I'm just wondering if we should have that, and I recognize that there's a process that we go through with Medicare, and I trust that. I just don't understand why we're removing this language in 256B.
Mr. Chair?
Representative Cagle.
Thank you. And I just want to kind of go back to then, if we go to page 6, 6.6, that I think that kind of in section 1, it says furnished under order by a prescribing physician or licensed healthcare prescriber who has authority in Minnesota to prescribe orthesis and prosthetics. So maybe staff can tell us what
Yeah.
statute that's referring to and what the definition of that is there, I guess?
Thank you, Representative Cagle.
So, Mr. Chair, Representative Nadeau, I mean, that is correct. The original language, referred to physicians, APRNs, and physician assistants and podiatrists, and that was including. And that language is replaced by the language on 6.12, which refers to the physician or licensed healthcare prescriber.
Thank
So
you.
it's sort of different phrasing of the language allowing that.
Thank you, Mr. Chun.
And thank you for that. And can I just follow up then?
Please,
You added
Representative Nadeau.
a licensed healthcare prescriber. I don't think I've seen that in statute. I haven't seen them all, but is there a definition to licensed healthcare prescriber then? Would that include a psychologist, a psychiatrist, a pharmacist?
Mr. Chair, Representative Nadeau, I think it depends on the specific service, because, there's a scope of practice, and people can prescribe, certain people prescribe prescription drugs, so the licensed prescriber is used in the pharmacy statutes. In this case, it would be prescribing, medical equipment. So I think whoever has the scope of practice authority to prescribe, that would be the reference to those individuals.
Thank you, Mr. Chun. Representative Nadeau, is this helpful?
thank-
And we can
thank you,
take it
Mr. Chair.
offline, too.
Yeah, thank you. I'll follow up with the author just to make sure that I fully understand this, so thank you.
Thank you, Representative Nadeau. Representative Hemmingson Yeager.
Thank you, Mr. Chair. I was just kind of perusing through that myself, and I think on lines 1.20, 2.23, and 2.28, it also does point out healthcare provider licensed in Minnesota operating within the scope of practice. So just wanting to say that my interpretation is that it's listed elsewhere throughout the statute, and just kind of echoing what Mr. Chun said, so thank you.
Thank you, Representative Hemmingson Yeager. Representative Quam.
Thank you, Mr. Chair, and I think it would be a good practice if, when we're asking for a definition and statute, that we be given the statute that the staff is referencing. And I believe that specifically listing like it was gives a safer level of confidence than going to an ambiguous phrase and guessing that there would be a scope somewhere or definition somewhere. So I'm a bit disappointed, and until we get clarification, I think we really need to, not have this go forward until everyone on the committee actually gets specific clarification, because we don't want to make a mistake and cause issues that open the door to problems. Thank you, Mr. Chair.
Thank you, Representative Quam. We will have some time to do that. We will proceed to lay the bill over today, but we'll have time to review that language and answer member questions. Representative Cagle, final word.
Thank you, Mr. Chair and members. I think that this is something that we need to make sure that people can live the lives that they want to, be active, play sports, and just be a kid. When we had this hearing in Commerce, one of the testifiers had her leg amputated when she was 10 and wasn't able to swim. Being a kid in Minnesota in the summer, can you imagine not being able to jump into a lake when it's hot? And so those are just some of the things that, we want to make sure that kids have the active lifestyle, that they're taking care of themselves, and that we're getting the equipment we need in a timely manner so it doesn't affect our health. So I appreciate the hearing and hope for its inclusion in the final bill.
Thank you, Representative Cagle. And House File 3339, as amended, is laid over for possible inclusion.